So my name is Ari Semet. I'm the program director here at Pulmonary and Critical Care Fellowship Program, Mount Sinai Medical Center. We've been around for 4 years now, 2026, 2027 academic year, but really this fellowship has been more than 40 years in the making. Started with Marvin Sackner, who actually introduced bronchoscopy in the United States of America. And then the fellowship went on a hiatus for about 10 to 15 years. And then I started it right after COVID, when the hospital realized that we could support another fellowship in pulmonary and critical care. So we have 6 fellows currently, 2 each year. We have 8+ attendings, actually more than 8 attendings now, 15+ rotations, and 52 weekly didactics. And let's take a deeper dive. So I'm the program director. I've been in practice here since 2008, trained at Robert Wood Johnson for internal medicine and Rush Medical School and in Chicago, and then Mount Sinai Hospital in New York for Pulmonary Critical Care Fellowship. Carolina De La Cuesta, who is the Chief of Critical Care, is our Associate Program Director and is invaluable to directing the fellows, as well as our very hands-on involved DeKidra Thompson, Program Coordinator. We have very diverse faculty, doctors that trained in Boston, as well as in South America, as well as here and in New York, places like NYU, Montefiore, the University of Pennsylvania, Penn State University, and just a diverse array of attendings. This is some of the pulmonary faculty, but we also have very involved surgical ICU intensivists who teach daily. Not listed here, people like Dr. Ascari, Dr. Rosario, just amazing attendings. This is the current list of our fellows, who are all excellent. Just to give you an idea of what we offer, we have MICU, days and nights, procedures, ICU leadership, pulmonary consults. We do inpatient bronchoscopy, PFT reads, SICU, do general surgery ICU, of course cardiovascular ICU, interventional pulmonary. We do ions and e-buses and even VATS with the procedure, with the great thoracic attendings that we have here. There's tumor board every Thursday. Ultrasound, we have a rotation in ER. We have simulation labs with ultrasound. We have PFT lab, about 10 reads per day when you do your PFT rotation. We have pulmonary clinic, half-day continuity. We do CCU rotation, and we have outside rotations in Cleveland Clinic, Jackson, transplant, and Nicholas for CF, cystic fibrosis. So Tuesday, we generally have some guest speakers in simulation lab. Wednesday, internal medicine grand rounds. Thursday is, I do with the fellows, a topic review, as well as top 10 literature review. And we have tumor board at 4:30. Then Friday is either SEEK, Journal Club, or case conference, and multidisciplinary with radiology and pathology. Here's a glimpse at the schedule, just so you could see it on the left-hand side here. You see, like Stern, for instance, has a month of consults, then he does ultrasound, then we do an anesthesia rotation where basically you learn how to intubate under controlled settings. Then we have PFTs and SICU, we have interventional pulmonary, we have an attending Dr. Softy and Dr. Williams, who are really the best of the best when it comes to ion and e-bus. Of course, they're surgeons as well, but they, our fellows, act as their fellows. I think that's my favorite rotation so far. And electives, of course, you could pick, and we have transplant at the University of Miami. That is a very well-liked rotation. It's a growing transplant center here at the University of Miami. So you could also see in the middle here, didactics in action. We have one of our own. Here's Dr. Alvarez giving noon conference on biologics and asthma. But we have 4 didactic sessions every week. We have research and national conferences that the fellows attend to. This year, they're all going to CHEST in Phoenix. They present at national conferences, and it's a very hands-on but comfortable setting for the fellows to thrive. One of the things we've expanded over the 4 years is hands-on labs. So, here's just an example of some of the things we did. Airway skills. We have some of the best surgical ICU intensivists. The fellows love working with them, and they give them a chance even to do bedside trachs, bronchoscopy hands-on, simulation lab. We have, before you even start, we have a simulation training in bronchoscopy, mechanical ventilation. We have modules and live procedural training. It's a very supportive environment, and the attendings are generally just very, very good and interested in learning and teaching. My job is to make sure that you pass your boards in your second year, and all the major domains are covered at least twice across the academic year: pulmonary critical care, cardiology, physiology, procedures, subspecialties, radiology, research and skills. We have a world-class radiologist here in Dr. Bill Burke, and he will have a session with the fellows once a year. I didn't mention, but we have a very supportive hospital here. Mount Sinai Medical Center is a growing hospital and very supportive administration. Things get done. We have the DIO, who is also invested in our relationship along with the CMO, constantly asking how they could help our fellowship thrive. So overall, I think it's a great program, and I hope to see you here.